I have a clinical science background in microbiology, and for many years I taught microbiology at the University of Leeds, with a research interest in antibiotic resistance. For about 10 years, my wife has suffered from repeated urinary tract infections. This is just one part of a very complex health need that she's got, and for a long time I've had care responsibilities, and I'm now her sole carer, and it is a full-time job. Her bladder infection started off being quite easy to manage with trimethoprim treatments, but sadly she became documentedly allergic to trimethoprim. Over time, and with repeated urinary tract infections, her bug developed resistance to penicillins, although at a very low level, and so she could be treated with high doses for long periods. Ironically, this was a result of the resistance mechanism that I used to study when I was researching antibiotic resistance. To give you some idea of the scale of the problem, she would develop urinary tract infections about once every month or so, perhaps shorter, perhaps longer. This was very, very difficult to manage, and she became completely confused during antibiotic treatments. This made her care exceptionally challenging. Often she wouldn't understand what was going on or why. Alongside her confusion is the fact that urinary tract infections don't observe office hours, and so frequently I would have to call the 111 service and go through their extensive algorithm for a problem that I knew exactly what it was, and then we'd have to wait for somebody to call us back. And then I'd have to introduce myself as somebody who understood antibiotic resistance and her needs, which fortunately, in my experience, mostly the GPs that I spoke to were very happy to listen to and to prescribe. Another problem is that the antibiotic that's usually prescribed for is an antibiotic where the supply chain has been fragile, and quite often it's been very difficult to source enough antibiotic to give her a full treatment course. It can be quite difficult to explain the subtleties of her particular bug. It's resistant to the drug that we need to treat it with, but at a low level. It's because the resistance mechanism just binds up and reduces the effective active concentration of the drug that we can give her. It can be quite difficult to explain this because medical education doesn't really have time to fit in the nuances of antibiotic resistance and understanding it. Another big worry for me is that in terms of antibiotics available to treat infections in the community, we're in the last chance saloon. And if this treatment doesn't work, inevitably she'll end up having to be hospitalized with all the costs that are associated with that. And also, from her point of view, it means much, much more increased care responsibilities and challenges. So I'm trying desperately to avoid that. But there is another major problem with her treatment, and that dates back to the pandemic when she suffered from acute pancreatitis at a time when surgery couldn't take place. As a result, her pancreatitis was treated with a cocktail of antibiotics that led, probably inevitably, to a C. diff infection, Clostridioides difficile, a bug that's associated with use of antibiotics that leads to the most horrendous diarrhea and a potentially life-threatening condition. Her C. diff infection relapsed a couple of times and was really difficult to treat. And then a couple of months later from her pancreatitis, I was being treated with a proton pump inhibitor, and I too succumbed to a C. diff infection, which again was a relapsing disease. And every time she now has an antibiotic, I have a dread that she'll get C. diff again. So all of this sounds terribly negative. Is there any positive out of the antibiotic resistance, antimicrobial resistance story? Well, yes. We were very lucky to come across a specialist urology nurse who suggested might benefit from hyaluronic acid treatment. If you think of the bladder as a wall with the epithelial cells as bricks in that wall, Hyaluronic acid is like the cement, and the treatment involves instilling hyaluronic acid into the bladder to essentially regrout the cell walls, or to regrout the bladder wall, and that means that the bugs that normally cause urinary infections have got no little hiding places in the crypts between the cells. She's had a couple of courses of treatment with this, and the really good news is that this has decreased dramatically the number of infections. Before the hyaluronic acid treatment, she was probably having monthly urinary tract infections. Since this stopped, which was about 6 months ago, she's had a couple of bladder infections, and so combating antimicrobial resistance isn't just a question of reducing the number of antibiotic prescriptions that are given out. It's perhaps a question of thinking outside the box and looking for alternatives to antibiotics. And are there other ways that we can stop infections or reduce their risk? And I want to take that as the positive to take home from this story.